Well, I think you should choose Mercy because we use a team approach. We really care about our patients. It's important to us that we help our patients get back to the lives they had before they became ill. We do a really good job. We work well together, and our number one goal is our patient. We give our patients a minimum of 3 hours of therapy a day. We work together with the patient. We set goals with the patient. We work with the families. And I feel like we just give better care overall because we encompass the family and all of our staff. From nursing to speech, occupational therapy, physical therapy, we all talk about all aspects of their care, and we try to coordinate their care so that they get the most out of their physical therapy and out of their speech and what have you. I'm a physical therapist assistant. I work with our therapists who evaluate the patients, set goals for the patients. I then follow the therapist guidelines to progress the patient toward those goals. We work on transfer training, bed mobility, walking, stairambulation, and anything that kind of comes in between there to help the patient become independent for discharge home.
The Mercy system has a wonderful reputation for excellent care. Our team is what makes us different than anyone else. We have a wonderful medical director. We have a team of therapists that work together like a family. Our team meetings are weekly. We discuss every patient, discuss the positives of what they've been doing for the week, what we need to work on to get them to the point where they can go home. The goal of acute rehab is to have the patient go back into their home setting and to be as independent as possible. We strive to work to have them doing their own cooking if that's the situation, to be able to be up and about on their own independently, and we all work together for those goals. If they like cooking, we encourage them to bring in one of their recipes, to have families perhaps have help with that, and to make something that they made 25 years ago.
I think one of the benefits of Mercy's rehab program again here at St. Charles is that it's an acute rehab program, which means that people are receiving 3 hours of therapy a day. That's the minimum requirements. All our criteria again are pointing for a home discharge. So we're working at supporting that care, trying to build in the level of therapies that they need between PT, OT, speech therapy, recreation therapy, nutrition therapy. Therapy standpoint again too, we will do co-treatments as well, where both therapies will intervene with the person at the same time, so that again physical therapy may be working on their standing tolerance and things, then occupational therapy will be working on something more functional in front of them, using their hands as they're trying to do something as well. So it helps from that standpoint to be able to have both therapies intervening at the same time again as well. Our patient care team is led by Dr. Shaw, who's a medical specialist in physiatry again. He is part of our team. He leads our program as far as our team conferences where goals are set for people, talking about length of stay, how much involvement everyone will have. We do meet weekly again, talking about what their status is. We give an update as far as how much progress they've made, but then we also focus more on barriers to their care, things that are impeding them getting home, so that we can really address and focus more on those levels as well. But one thing that's unique about our setting here is that we have a bell of celebration. There's a bell that's located on a mobile post so we can take it to the person again if they aren't able to come out to us, and ring the bell every time that we accomplish something. It's mostly wrong when people are leaving again because that's the biggest celebration, that they're going back home again. But every minor thing, the first time they stood up, the first time they walked 100 feet, the first time they were able to do something for themselves, we try to ring the bell and celebrate as a group again. So whenever we hear the bell ring, we all try to celebrate with the person who is ringing the bell and have a little party to celebrate that new accomplishment.